This is our castle. Our bones are the bricks and our blood is the mortar.
When the core is functioning correctly, it is an incredibly strong and efficient region of the body. But when it is working incorrectly, the simplest of tasks can seem difficult or painful. Now, the core refers to the lumbar spine, pelvis, and surrounding musculature. The lumbar spine in isolation is vulnerable to movement and high load, but it is incredibly strong when properly locked into its neutral position by the surrounding musculature. When thinking about how to train core stability, think about doing your best impression of an unopened can of soda. This soda can is a fantastic analogy and simplifies a complicated and poorly understood region of the body. Just like the human core, a soda can is a pressurized cylinder that, when unopened, can support an immense load. If it is opened and emptied, it is still incredibly stable for what it is, a thin hollow cylinder of aluminum. The key to its strength is the shape and the pressure. Once again, physics. The top and bottom of the can need to be parallel, and the whole circumference of the wall needs to be intact. If there is a hole or dimple in the side, it will lose its stability. Our core requires the same things to be in place to function correctly and efficiently. The top and bottom of the core are the diaphragm and the pelvic floor. Those need to be active and parallel with each other. When the pelvic floor and the diaphragm are parallel, the lumbar spine and pelvis are in a neutral position. The deep spinal stabilizer muscles are great at keeping our spine and pelvis in the correct position, but not as good at keeping it there under load. That will require you to learn a specific set of skills. The muscles that give us stability under load are abdominal wall muscles, just like the aluminum can walls. When we need an increased amount of core stability, we can accomplish this by creating pressure in the abdomen by using our diaphragm. You may have heard someone say, "Brace your core before lifting a heavy weight." This is a common bracing cue, and it is used to protect your body from harm while resistance training. However, this cue can be improved by knowing how bracing works to protect your spine. All of the muscles of the core are working together to provide stability to your spine. In order to brace correctly, you need to be able to use your diaphragm to generate this intra-abdominal pressure, like a pressurized soda can. And a reminder that our core is controlled by our nervous system. That system places a high priority on survival and preventing injury, so it will do just about everything to prevent your spine from buckling. So, if you are not stabilizing correctly, you will subconsciously recruit whatever other muscle you can to aid in spinal stabilization. Like with all other exercises, you must perform it correctly or damage yourself. The nervous system will cause muscle stimulation according to the functional demand. If the exercise does not require activation of the core stabilizing muscles, the brain will not activate them. The main function of the muscles in the internal unit is to stabilize the vertebral column, the rib cage, and the pelvis. Stabilization of the back provides the lower limbs, arms, and head with a stable base from which their movement will be created. Stabilization of the back is the basis for the stability of the body. In normal functioning, the muscles in the internal unit are stimulated in action a few milliseconds before limb movement. Stability begins in the core muscles and passes from the center to the periphery to the limbs. Regarding the abdominal muscles, good stability for the vertebrae column and the limbs is achieved via the action of the transverse abdominis, which influences the lower vertebrae in the pelvis. The transverse abdominis muscle stabilizes the vertebral column. During constriction of the muscle, the navel is pulled inwards and both sides of the pelvis are pulled towards each other. This leads to a significant chain reaction in the thoracolumbar fascia connected to the lower vertebrae thoracolumbar fascia. The transverse abdominis connects to the tissue. Contraction of the transverse abdominis pulled the fascia from both sides of the vertebral column. The final product of this action is increased stability on both sides of the vertebral column simultaneously. Our spine and the entire abdominal area is like a big balloon that contains all of the internal organs and a self-regulating system for the balloon to maintain internal pressure and not explode or collapse. To achieve this, we must wrap it tight in a girdle and protect it from all sides. This is how our abdominal girdle is built. The walls around it, or actually the muscles that stabilize the abdomen and spine. Bracing is a technique for stabilization of the spine. Basically, in bracing, we tighten all of the muscles surrounding the abdomen. As we contract the abdominal muscles, the erector spinal and muscles immediately go into action and support the back from the rear. In essence, we create a natural girdle that stabilizes and protects the spine.
This is our castle. Our bones are the bricks and our blood is the mortar.